I wanted to talk a minute about trauma processing. A lot of people are scared of it because they're worried about what's going to come up. They're worried about their reaction. Some people are concerned that perhaps something happened to them they're unaware of, which we might call a repressed memory. But in trauma processing, we're not trying to find any repressed memories, because a psychologist by the name of Elizabeth Loftus has already shown that doesn't really exist. So what we are working with are those intrusive thoughts, those flashbacks. You know, sometimes you might get an emotional flashback and it's like reliving that trauma again, and it can be really awful. Sometimes you might have visual flashbacks. The memories are just coming faster and faster, and you're feeling out of control. And maybe you're having nightmares. Maybe you're feeling hypervigilant, like unsafe in the world. Maybe you're lashing out at your partner. These are the things we process. And the reason why we process it is because if it's intruding into your life, we can do it in a safe environment with a safe person who you trust, right? Like a mental health professional. Part of the reason why it's less distressing with a mental health professional is because they have the tools to teach you to go back into your body. Where are you now? Where are you in the present? You're safe. Let's put that memory back here in the past where it belongs, so it's not intruding anymore. Some of the different trauma therapies use different methods. The base is cognitive behavioral therapy, and that's looking at those negative thoughts like I'm not safe, I'm out of control, I was abandoned, and trying to use something more adaptive to improve our mood and to remind us, you know, not to focus too much on our cognitive distortions, black and white thinking or catastrophizing. And so both EMDR and brain spotting will also touch on CBT to look at, well, what are those negative thoughts and what would be more adaptive? And how do we use our body to unlock this trauma, to shake it off, to let it go, to release it, so it becomes less and less intrusive over time. The alternative to not processing the things that are giving you nightmares, flashbacks, harming your relationship is more intrusions, more intrusions, more intrusions. And these aren't timed, you know, it's when you're stressed, when you're tired, when you get triggered, and those triggers could be anywhere. So trauma processing isn't easy in the beginning, but it becomes easier over time. And over time, your body becomes more calm, and you begin to feel safer, and your relationship starts to improve, and your self-worth starts to improve. I'd really like to be able to help you move into this safer space. Remember, be kind to yourself and others.